Chronic diseases are everyone's business. Many of us will suffer from at least one chronic condition in our lives. Some of the most common chronic diseases are diabetes, cardiovascular diseases, stroke, and mental conditions. Nearly 1 in 4 Europeans suffers from a long-standing problem which restricts their daily activities. Many of us will, in later life, get at least one chronic disease. 65% of people over 65 have more than one disease, and this number rises to 85% for people over 85. Managing and treating chronic conditions also places a big burden on our health and social systems. The major causes of chronic diseases are known: sugar, smoking, inactivity, alcohol. About 80% of all heart diseases, strokes, and type 2 diabetes could be prevented by reducing risk factors and by ensuring we all live and work in environments that protect our health. In the EU, 70 to 80% of healthcare budgets are spent on treating chronic diseases, more than 700 billion euros every year. 97% of these budgets are devoted to treatment, chronic disease management, and healthcare administration, whilst a mere 3% is spent on prevention. Many chronic diseases are preventable, or their onset can be delayed. How can we invest better? There are answers all across Europe that can reduce the burden of chronic diseases by better using the existing knowledge and good practices on effective, efficient, and holistic ways to manage chronic diseases. The EU Joint Action on Chronic Disease and Healthy Aging is a collaboration between the European Commission and the governments of 26 European countries. It brings together over 60 organizations across the EU that are working together to facilitate the exchange of good practices on the prevention and care of chronic diseases across Europe. The Joint Action CRODIS paves the way for better health policies across Europe to improve the well-being of citizens.